Asthma, the natural solution to asthma attack and relief management therapy. Written by Dr. Orghe Pharry, narrated by Micheal Borge. Introduction. This book teaches every asthmatic patients and non-asthmatic patients the information necessary for recognizing, managing, avoiding the occurrence and also to treat asthma attack and exacerbations. It is an excellent resource for asthmatic and non-asthmatic patients. If you are highly concerned about your health status and healthy living, you should see this guide as everything needed to understand and manage asthma attack in children and adults without being only restricted to asthmanefrin, asthma inhaler, nebulizer machine, asthma mask, asthma spacer, asthma machine, and not limited to asthma medicine. This book is ideal for understanding how to develop an asthma action plan based on the principles of assessing and treating asthma attacks, having full knowledge of the causes of an asthma attack and symptoms, diagnosis and stages, ambulatory asthma treatment, managing asthma attacks, and many more. Asthma is a chronic respiratory disease that often leads to severe episodes of symptoms. Asthma can be an incurable disease of the airways. The condition causes swelling and narrowing inside the lung, restricting air source. The symptoms of asthma often occur with periodic attacks or signs of tightness in the upper body, wheezing, breathlessness, and coughing. Due to the development of asthma, the airways swell and are extremely sensitive for some of the substances a person might breathe in. When this increased level of sensitivity causes a reaction, the muscles that control the airways tighten, and doing this they could restrict the airways even more, result in an overproduction of mucus. The group of inflammatory events in the respiratory system can result in the severe symptoms of the asthma attack. Worldwide, around 250,000 people pass away every year from asthma. Asthma episodes occur when symptoms are in their peak. They could begin all of a sudden and can range between moderate to severe. In a few asthma attacks, bloating in the airways can completely prevent oxygen from getting to the lungs, which also halts in getting into the bloodstream, planning a trip to vital organs. This sort of asthma attack can be fatal and requires urgent hospitalization. In the beginning of the asthma attack, the airways allow enough air into the lungs, but it generally does not allow for skin tightening and leave the lungs at an easy enough rate. Skin tightening is poisonous if your body will not expel the gas. An extended asthma attack might trigger a buildup of the gas in the lungs. This may further decrease the amount of oxygen entering the bloodstream. People who have apparent symptoms of asthma should see a doctor. They'll provide treatments and advise on management techniques as well as determining potential causes for asthma symptoms and how to prevent them. The physician will also recommend medications in reducing the rate of recurrence of asthma episodes. Asthma is a common long-term inflammatory disease of the airways of the lungs. It is characterized by adjustable and repeating symptoms, reversible airflow obstruction, and easily triggered bronchospasms. Medical indications include episodes of wheezing, coughing, chest tightness, and shortness of breathing. These might occur several times each day or several times weekly. With regards to the person, they could become worse during the night or with exercise. Asthma is regarded as the effect of a mixture of genetic and environmental factors. Environmental factors include contact with polluting of the environment and allergens. Another potential set-offs include medications such as aspirin and beta blockers. The analysis is usually predicted on the design of symptoms, response to therapy as time passes, and spirometers. Asthma is classified based on the frequency of symptoms, force, expiratory volume in a single second, FEV1, and top expiratory stream rate. It can also be characterized as atomic or non-atomic, or atopic identify a predisposition towards creating a type 1 hypersensitivity response. There is no cure for asthma. Symptoms can be avoided by staying away from causes such as allergens and irritants, and through inhaled corticosteroids. Long-acting beta-agonists, LABA, or anti-leukotriene agents can be utilized in addition to inhaled corticosteroids if asthma symptoms stay uncontrolled. Treatment of rapidly worsening symptoms is usually with an inhaled short-acting beta-2 agnostic, such as salbutamol and corticosteroids taken orally. In very severe instances, intravenous corticosteroids, magnesium sulfate, and hospitalization may be needed.
Sample complete. Ready to continue?